Everything started around 2009 when a delegation from the Bill and Melinda Gates Foundation and the Global Fund approached our then CEO in Atlanta with a simple request to bring some innovative private sector thinking into the fight against TB, AIDS and malaria in particular. So the request was, we pouring billions of dollars into making medicines available to various African countries, but we're still facing problems in making sure that they get to the point of need.
Healthcare and access to medications has always been a challenge in sub-Saharan Africa. Project Last Mile is one of the solutions, not only making strides in terms of reaching people who need to access healthcare, but also sharing how Coca-Cola's distribution works with governments to get medicines to far-flung clinics that are sometimes inaccessible due to lack of infrastructure and development. Eswatini is bordered by Mozambique and South Africa. It is 200 kilometers north to south and 130 kilometers east to west, making it one of the smallest countries in Africa.
Basically, what Project Last Mile is saying is that the concepts that the Coca-Cola company uses, let us try and interpret them into the health space. The first phase of the project started with focusing on the girl. We did ZIMET neurological research. It's a Coca-Cola kind of like research that they've done previously as well, where basically you just get into the minds of the young girl.
In 2017, the Global Fund to Fight AIDS, Tuberculosis and Malaria invited Project Last Mile to support the Ministry of Health in Eswatini by leveraging the Coca-Cola company's marketing expertise to create demand for HIV prevention, specifically amongst young women and girls. This has become known as Project Girl Champ.
So basically what Girl Champ does is to say, let us empower the girl. Even though the crux of the matter for us is behavior change in terms of sexual and reproductive health, but we decided to look at the girl holistically.
As a career guidance teacher, with our timetable, we have scheduled time, Wednesday from 1 to 2 p.m., where we collect all the children for a section. But yes, it helps because some of the parents take it hard to talk to their children. We start as group discussions. That is when everyone opens up. Because individually it is hard on a one-on-one, it is hard to open up. So if there is this one learner with a very challenging situation, speaking out, the next learner also will describe, yes.
Actually, they have created a situation whereby we are able now to take care of these people. Initially, we were not friendly in terms of taking care of them. Yeah.
HIV and AIDS is one of the public health threats that we are responding to as a country, and we've done that since 1986 when we first identified the first HIV case. And we've been responding as a country, and we've seen the response improving with the years. And we've seen quite a good result in terms of the levels as we measure. The strategy had then to work out to say, how do we make the health facility a place to be, the in place? What can we do? Yes, a safe place. So that's what Girl Champ program did, to try and demystify what you get in facilities and work with the health workers so that they know that health workers are approachable. Health workers, when you get there, you will get information. So we did that in the 3 communities, and we think when we activated those programs, we saw that no, we've achieved to make, yes, it's a positive change.
Project Last Mile, I would say it was of great help. It made the facility to be known to the youth. And the youth learned that we, as a facility, we are there for them.
Now, Sister Nomahlubi, can you just tell us about Project Last Mile? How have they been helpful?
Okay, like Project Last Mile was so very helpful because we were able to empower our girls, because we have face challenges with our girls in the community. They were not well empowered, like especially we were experiencing more pregnancy, like teenage pregnancy.
For a small country like Eswatini, I must say they are doing quite a lot in terms of reaching out to the communities. It was just great to see just how much these young girls' lives have changed. I mean, to start off with a statistic, a pregnancy statistic as young as 13 to now 18 to 20, it shows just how much this initiative has impacted their lives.